Today we're going to be doing some Botox on TJ, and he's a young guy, but you can see there's never an early enough time to start when you're talking about rejuvenating. There's a special word that we use called prejuvenation, and that's how we inject and prevent wrinkles from forming as time goes on. So TJ, how old are you?
24.
He's a young guy, but he has active muscle lines. Let's see your forehead. Can you crinkle up your forehead and then squint your eyes for us? You can see he's got some real active dynamic lines up in his forehead and some little crow's feet at the corners of his eyes. And so we're going to go ahead and give him a little Botox today that will help to relax those lines and prevent those lines from getting deeper. So before we get started, I always like to mark my patients to make sure I know exactly where I'm going to put the Botox. We avoid all kinds of side effects by doing that. Plus we get areas that you couldn't necessarily see without marking. So go ahead and look way up over your head for me. You can see he's got real active lines all the way up here. Now if we hadn't had him make that motion, we would have thought, oh, we'll just stop up here. But you can see his lines go up even more superiorly. So we want to get all of them, so he doesn't have crinkling up top and nothing below. That's a dead giveaway for someone who's had Botox. And frown like you're really mad. He's got good strong muscles right here. We want to make sure that we give him a little in there as well. And then look way up again for us. So another area I always like to inject is this lateral side of the eyebrow. The reason we like to do that is because if we're not giving him just a little bit of Botox there and over here, they end up getting something called Spock brow, which is where the brow goes up and patients look surprised all the time. We want to avoid that as well. And then squint as if you're looking right into the sun. Use these muscles right here. You can see he's got little tiny beginnings of crow's feet, and we're going to inject those as well. We always want to mark everything before we get started. Okay, I think we're ready to go. I'm going to put him back just a. We're going to start in the middle of the forehead here and get this big strong muscle. Just put a few units in each area. How are you doing so far, TJ?
Doing good.
Good, you're doing great. Come over here to the lateral side. A little bit of an injection here to prevent Spock brow, as we call it. And same thing on this side. Just 2 or 3 units is all we need on the lateral side of the brow. And then before we go into the crow's feet, we always want to change out our needle. So make sure the patient's completely comfortable. And we'll have him turn a little bit to the left there. Kind of pinch the skin. It feels less pokey when you distract the skin. A little bit more here. Still doing okay, TJ?
Yep, can't complain.
Great. You're doing beautifully. We're going to do the same thing on the other side. Little injection right at the beginnings of the crow's feet there. So you can see really minimal discomfort, minimal bleeding, no bruising. TJ just sailed right through that. Great job.